Hey everyone, welcome back for another deep dive. Today we're going to be looking at something pretty personal.
Okay.
We're going to be talking about ED, erectile dysfunction. And, you might be listening to this thinking, oh, this doesn't really apply to me.
Right.
But did you know that studies show that between 30 and 65% of men
Wow.
between the ages of 40 and 80 struggle with this?
That's a big number.
That's a huge chunk of the population.
Yeah, it's true. And I think for a long time, this was something that was kind of swept under the rug. People didn't really want to talk about it. But the reality is that it's incredibly common and there are solutions out there.
And that's what we're here to explore.
Exactly.
We're going to be talking about this new research on a treatment called low-intensity extracorporeal shockwave therapy.
Okay.
LICE-SWT.
LICE-SWT. Yeah, it's a mouthful.
It is a mouthful for those in the know.
Yeah, so LICE-SWT is a relatively new approach to treating ED.
Okay.
And it's non-invasive, which is a huge plus. Basically, it uses these targeted pulses of energy to stimulate healing and growth.
So like a tiny little massage for, down there.
Imagine those tiny pulses promoting the growth of new blood vessels.
Yeah.
And that process is called angiogenesis.
Angiogenesis.
And it's key for healthy blood flow.
And as you can imagine, good blood flows is essential for, you get the picture.
You get the picture.
So we've got this new treatment.
Yeah.
But does it actually work?
Right.
What does the science say?
So that's what we're here to unpack. We've got a meta-analysis of 7 randomized controlled trials,
Right.
The gold standard of research.
Nice.
Published in the journal Therapeutic Advances in Urology.
Wow.
And these trials involved over 600 patients. So this isn't just a handful of anecdotes.
So what did they find?
Right.
Did LICE-SWT actually help these men?
Well, the results are pretty remarkable. The study showed that LICE-SWT led to a significant improvement in what's called the IIFEF score, which is basically a way to measure how well things are, shall we say, functioning.
Right.
Men who received LICE-SWT saw a noticeable improvement compared to those who got a placebo.
Noticeable how, were they able to?
Yes. The research showed that men receiving LICE-SWT were 6 times more likely to achieve a satisfactory level of firmness.
Wow.
And some of them were seeing this improvement within just 1 month of treatment.
That's incredible.
It is.
Especially for guys who haven't had success with other treatments.
Absolutely. And what's even more encouraging is the safety profile.
Okay.
Most of the studies reported no adverse effects at all, and the very few side effects reported were minor, slight irritation.
So it seems like LICE-SWT has the potential to be a real game changer.
Yeah.
In the world of men's health.
It really does. And the best part is we're only just beginning to understand its full potential.
This is all incredibly fascinating, but I'm sure our listeners are wondering about the details.
Sure.
Can you walk us through what a typical LICE-SWT treatment actually looks like?
Of course. So the procedure itself is quite straightforward. A trained healthcare professional uses a handheld device that delivers those focused energy pulses to specific areas.
Okay.
The treatment sessions are typically short, often less than 30 minutes, and most patients require a series of sessions over a few weeks.
So no surgery, no pills, just a few quick sessions. That sounds pretty manageable.
Right.
But let's go back to those results for a second.
Sure.
You mentioned that some men were seeing improvement within a month.
Yes.
Can you elaborate on that?
Absolutely. One of the most compelling aspects of this research is how quickly some men experience those positive changes. Imagine someone who has been struggling with ED for years. Maybe they've tried other treatments that haven't worked, and then after just a few weeks of LICE-SWT, they start to see a real difference. It can be life-changing.
That's amazing. It really highlights how this treatment could offer hope to men who thought they were out of options.
Yeah.
Speaking of options, are there certain types of ED that LICE-SWT is particularly effective for?
That's a great question. While the research is ongoing, the initial findings suggest that LICE-SWT may be especially beneficial for men with what's called vasculogenic ED.
Vasculogenic ED, that sounds complicated.
It's actually pretty simple. Vasculogenic ED is the most common type of ED, and it's caused by problems with blood flow to the penis. And remember, LICE-SWT is all about promoting the growth of new blood vessels. So it makes sense that it would be particularly effective for this type of ED.
So for men whose ED is primarily related to blood flow issues, LICE-SWT could be a real game changer.
Right.
But you mentioned that the research is still ongoing. What are some of the areas that scientists are still exploring?
One area of active research is determining the optimal treatment protocol. Scientists are looking at things like the ideal number of treatment sessions, the frequency of those sessions, and the intensity of the energy pulses. They're trying to fine-tune the approach to get the best possible outcomes for patients.
So like figuring out the perfect recipe for success. But I'm curious, you mentioned earlier that we're just beginning to understand the full potential of LISWT. What are some of the other possibilities beyond treating ED?
That's where things get really exciting. Remember, LISWT is all about stimulating healing and growth. So researchers are exploring its potential applications for other conditions that involve blood flow and tissue regeneration.
Like what? Give us some examples.
Well, there's promising research looking at the use of LISWT for wound healing, particularly in cases of diabetic ulcers, which can be very difficult to treat.
Oh, wow.
There's also research exploring its use for pain management, especially for conditions like tendinitis and plantar fasciitis.
So we could be looking at a future where LISWT is used to treat a wide range of conditions, from ED to chronic wounds to pain management. That's pretty incredible.
It really is, and it speaks to the power of harnessing the body's own healing mechanisms.
This is all incredibly fascinating, but I imagine some of our listeners might be feeling a little overwhelmed.
Right.
It's a lot of information to process.
Right.
So let's take a moment to recap some of the key takeaways. Would you agree that the most compelling aspect of LISWT is its potential to help men who haven't had success with other ED treatments?
Absolutely. The research we've discussed today clearly shows that LISWT can be a viable option for men who haven't responded to traditional medications or who are looking for a non-invasive alternative.
And it's not just about the effectiveness, it's also about the safety profile. We've talked about how most studies report minimal to no side effects. That's a huge plus, especially when you compare it to some of the potential side effects of medications.
That's a crucial point. The fact that LISWT appears to be so well tolerated makes it even more appealing as a treatment option.
Okay, so we've covered the compelling evidence, the potential benefits, and the safety profile. What else is important for our listeners to understand about LISWT?
I think it's important to emphasize that while the research is very promising, LISWT for ED is still a relatively new field. There's still much we're learning about how it works and how to optimize its effectiveness.
That's a good reminder. Science is a process of ongoing discovery. So where can our listeners go to learn more about this evolving field of research?
Reputable medical journals are always a great place to start, and of course, talking to a healthcare professional who is knowledgeable about LISWT is essential. They can provide personalized guidance and answer any specific questions you might have.
Absolutely. It's always best to consult with a healthcare professional to determine if LISWT is the right treatment option for you. But beyond the science and the medical advice, I think there's something truly inspiring about this treatment.
What do you mean?
Well, we've been talking about all these amazing scientific advancements, but at the end of the day, LISWT is about helping people regain a sense of intimacy and connection. It's about improving quality of life and empowering men to feel confident and fulfilled in their relationships.
I couldn't agree more. There's a very human element to this research that often gets overlooked. It's not just about treating a physical condition. It's about helping people live fuller, happier lives.
And that's what makes this deep dive so rewarding. We're not just exploring the science. We're exploring the potential for positive change in people's lives.
Absolutely.
And we're back. I hope everyone's had a chance to process all that amazing information about LISWT.
Yeah, there's a lot to unpack.
There really is.
Yeah.
But I think it's incredibly exciting stuff.
Absolutely.
You know, we've talked about how it works, the science behind it, the potential benefits, and even the emotional impact it can have.
Yeah, and the safety profile, too.
Absolutely.
Yeah.
We can't forget about the safety profile because, you know, a lot of medications have some pretty nasty side effects. And it seems like this is really well tolerated.
Exactly, and that's what makes it so appealing as a treatment option.
So as we wrap up this deep dive into the world of LISWT, what are some of the key takeaways you'd like our listeners to walk away with?
Well, I think first and foremost, I want to emphasize that ED is a common issue. It's nothing to be ashamed of.
Right.
There are solutions out there, and LISWT is showing incredible promise as a safe and effective treatment.
It's really about breaking down the stigma and empowering men to seek help.
Absolutely.
And, you know, beyond that, I hope our listeners are as excited as we are about the future of LISWT.
Me too. The research is moving so quickly, we're constantly learning more about its potential applications.
It's like we're witnessing a paradigm shift in healthcare. You know, we're moving away from just managing symptoms and towards actually addressing the underlying causes of disease.
I love that. That's a great way to put it.
So before we sign off,
I
want to leave our listeners with one final thought.
All right.
If you are struggling with ED, or if you're just curious about new innovative treatments, don't hesitate to do your research.
Right?
Talk to your healthcare provider. Explore reputable medical journals and stay informed about the latest developments.
Knowledge is power, and it's never been easier to access information about your health. So be proactive, be your own advocate, and explore all the options available to you.
Well said. That is some great advice. I think this has been an incredibly insightful conversation, and I want to thank you again for joining us today.
It's been a pleasure. It's always a joy to share my passion for Lee's WT and its potential to change lives.
And to all our listeners out there, keep exploring, keep learning, and stay curious. Until next time, stay healthy and be well.